Virtual ward service, or otherwise known as hospital at home, is a safe alternative for the patients who would have otherwise ended up being in the hospital. We have various clinicians within the hospital setting calling our base. The triager answers the phone call, takes the history of the patient, then they call one of the clinicians such as myself, give us the patient history, and off we go to the patient's house to see them. We divide our caseloads in a way that we are about half an hour away, so our response time is quite quick in terms of accepting the referral itself.
Hello, Eric. How are you?
Oh, I'm very well, thank you.
I had an extremely bad chest infection, and I was advised to, by my GP, to go to A&E. They came to the conclusion that I could go home and be remotely monitored. Well, the clinician would come around and check to see if everything was okay, and of course they would be able to administer whatever was necessary.
Most of the things that can be done in the hospital can be replicated at the comfort of your patient's house. The scope of practice has improved. We do a range of examination, investigation, health assessments safely, effectively, and cost efficiently in the comfort of the patient's house.
Of course, one of the major benefits is a comfortable bed in your own house. If I like to read and watch TV or paint or sculpt, one can do it one's home if one has the facilities. I can do exercise, which I wouldn't do necessarily in a hospital ward.
It helps in a smooth discharge process within the hospital. There is no bottleneck effect wherein patients are having to wait in ED. Hospital-acquired infection is what can be avoided, and again, from an operational perspective, it also saves finances. Should the patient needs escalation or should the patient needs hospital-based investigation, we can facilitate that in a time-specific manner.
Physically and mentally, I think it is very beneficial indeed. Look forward to the time when it could be expanded.
From a clinician's perspective, it's always better to give a choice to the patient so the patient can make an informed decision of their well-being. Time and time again, we have seen that the patient would prefer having their treatment at their own place.